Mission and margin is the business of healthcare. New York City physician practices found themselves at the coronavirus epicenter. In a matter of days, patients became panicked, revenue dried up, and some clinical and administrative staff were furloughed. In this interview, we bring together a physician practice leader and his digital partner to share their experience and results data. Medical Offices of Manhattan physician practice leader Craig Gruen and digital agency Tidal Health co-founder Brian Cush joined BOH to share how they rapidly virtualized their workforce and responded to the COVID-19 patient and provider concerns. Their approach centered on live chat, a triage bot, telehealth, and other technology innovations. Visit our website at www.bohseries.com to learn more and see our schedule of live events and virtual roundtables. Welcome to Business of Healthcare. And Craig, maybe I could kick off with you to tell us a little bit about Medical Offices of Manhattan.
Sure. Thanks for having me. So Medical Offices of Manhattan is, we have 3 offices, about 30 plus providers, upwards of 70,000 patients. We also have Manhattan Cardiology, which is a sister brand to Medical Offices of Manhattan, or MOM as we reference it. And there's 2 locations in Midtown there. So, safe to say we're a pretty large operation.
Yep. Brian, how about you? Tell us a little bit about Tidal Health.
I'm the co-founder of Tidal Health. It's a marketing and communications agency that specializes just in healthcare. We're based in Manhattan, very close to Mom and Craig's team out there. We really focus in patient acquisition from a digital side, but also understanding that patient's journey and experience past becoming a patient. And that kind of latter half is really what we were forced to focus on and become our primary service within really the last 2 months.
For most folks that I talked to, there was a moment when they realized this was going to be something really, really big. Craig, for you, what was that moment as you were sitting in New York City?
So as we sat in New York City, I think for me and our team, kind of our aha moment was we were scheduled to go down to the HIMSS conference. And for those not familiar with the HIMSS conference, it's the largest healthcare conference in the world. 40,000 people gather annually. Last year and this year, which was scheduled to happen at the Orlando Convention Center, was canceled just a few days before the event. I think at that point, to me, when you have 40,000 people of the brightest minds in healthcare decide that it's neither safe or prudent to all gather and travel and meet, that pretty much really raised the red flags if we were about to kind of get more serious with this. And then to follow up with that, in different industries, entertainment, you had the South by Southwest Festival, Coachella is a big music event. Both of those events canceling really kind of cemented in my mind that we are on the precipice of things getting drastically different in terms of people being able to gather in the same place. So I think that to me was really the moment where I realized we're going down a different path.
What about you, Brian? What was your moment?
Yeah, there was 2 distinct moments, one personally and one professionally. The personal one, I remember the exact night. It was March 11th on a Wednesday. I was actually guest lecturing at a marketing class. My friend's a professor at FIT, a university here in Manhattan. And he told me as I was walking in the class that we were actually the last class, and then the entire university was going virtual the following morning, that Thursday morning. So for that large scale of a university right in the heart of Manhattan to make that decision really made it aware personally. And then on the professional side, we started to see patients cancel their elective and ambulatory surgeries. So it really became the front end of what then obviously really became an entire society shutdown.
Craig Gruen helps lead Medical Offices of Manhattan, the largest independent primary care practice in New York City. Prior to the pandemic, 30 providers and 150 employees served patients in 3 primary care locations and 2 cardiology clinics. How did things start? You beginning of March and patients started to really just like we discussed, start to realize that something big was happening. What did you experience as a physician practice?
So I think internally, our practice, as people were still moving about around New York City and going to events and traveling for the most part, to some extent, we saw an immediate spike in volume of patients reaching out to the practice. This was across the board. We have a lot of patients that come for annual wellness checks or annual physicals once a year. That's probably the only time they're in touch with us. All of a sudden, these annual patients were nowhere near their date of service, and they were reaching out to their doctor's office. So all of a sudden, at once, we had a whole lot of people concerned. I think at this time period, early March, kind of into mid-March, we had a lot of inconsistent info out in the public, whether the media was portraying it. I think healthcare agencies and news outlets were confused on some of the data. So during this time period, a lot of people were reaching out to their physician's office as kind of a lifeline to figure out, what do I do? Can I travel to my aunt's, anniversary this weekend? Can I go to a trip to Florida for spring break with my old college friends? Can I do any number of things? And they were relying on us. So immediately we saw a spike in volume. This is while the office was still open. This is why people are still moving about. But right away, that was kind of like, wow, we need to start coming up with a different workflow to kind of address some of these inquiries.
Tidal Health's co-founder Brian Cush also joins the conversation, sharing how Tidal Health pivoted from helping more efficiently engage new patients on behalf of their clients to more effectively responding to a clinical and business crisis. In addition to medical offices of Manhattan, Cush advises many New York City healthcare providers on serving patients and keeping the doors open during the crisis. Brian, tell us a little bit about how you come into the story here.
Yeah, certainly. We've had the pleasure of working with Craig and his team for several years, and really always took the primary focus of patient acquisition. But almost overnight, that turned into more of an operational or really consulting role, because like Craig mentioned, we had this influx of existing patients that normally may not have communicated or reached out with just a kind of a plethora of questions and concerns. The good thing was we already were implementing, and from the website you can kind of see on the right hand side was a live chat feature to help kind of handle the scale of patient communication. So we already were a few weeks into that and really knew that there needed to be some topic that was COVID-19 related. We weren't sure exactly what questions or kind of the true source of the question was, but really quickly we saw that there was a multiple kind of X volume increase in communications through that topic and channel. And that really is where then even yourself, Matt, we started to engage with and create some kind of process. It seems like a lifetime ago, but really first on, it was patient safety, and even staff safety was kind of priority number one.
According to Gruen, business partners were key. LabFinder, a sister company to physician practice, located COVID-19 testing capacity. Tidal Health adjusted digital strategy and assembled other key partners. MedChat helped with increased patient communication and staff working from home with live chat and a COVID-19 triage bot. Capsule provided prescription drug home delivery. None of these partners could have anticipated how important their capabilities would be just 2 weeks earlier. As I step through the bot, can you just talk for a moment about kind of how the chatbot fit into your overall workflow?
Sure. So we've always had, at least for the last year or so, a remote communications team that helps handle things after hours, over the weekend. And we had been using MedChat, which is what built this bot, to some extent to help handle our volume. We're a very busy practice when at 100% and when the wife is normal. So we had already been using MedChat, and we realized very quickly that we needed to optimize it. We needed to figure out how to help our overall volume, but also how to help in terms of COVID-19. So by building out some questions in this bot during live hours, our staff was able to already have a bunch of crucial information before they even, connected with the patient. Date of birth, pulling up their chart, but also answers to some questions, whether they had traveled or been in contact with anybody COVID positive. And all of this was extremely helpful in terms of how quickly that interaction was going to go. We didn't have to start from scratch. So very quickly we realized that we needed to build this out, but not only from a live standpoint. Once we built the after hours bot, we were really able to collect this information where this traditionally would have went to a voicemail and been added to a long queue of voicemails. But now these patients were giving information, and we actually had some of our remote communications team be joined by a provider that used to work with us that we put back on the payroll to kind of help kind of triage some of these evening requests and evening inquiries. So, very quickly we started adapting to the times and building this out so that we could really address patients as much as possible between 7:30 a.m. and midnight. And then when we picked it back up at 7:30 a.m. the next day, we already had a line in a queue that was super organized and had a bunch of information so we could jump right back to it. So the optimization of MedChat overall really helped us kind of sort through some of these requests, mostly COVID related, but some others as well.
Brian, let me go back to you and just ask you to talk for a moment about what you were able to achieve as this data activity or this activity on the website really started to spin up.
Yeah, I think really quickly, and Craig touched upon that, we found that there was a kind of a huge spike in these corona-related inquiries, but then underneath them, they broke out into a lot of subtopics. So, and a lot of it was things that were just concerned initially more on a human side. If there's people asking if they should go back to work or if this other condition has a relationship to this. But we found a really quick and early adoption from the graphic that Matt just threw up there, that most of the people that came in and were initiating the chat came from an organic source. So that was just someone searching on a search engine that brought them to the Medical Office of Manhattan website. You can kind of break down the categories after that of direct traffic and paid traffic. But we had almost a little bit of a field of dreams moment that the technology was there and people were using it early on. We opened up this COVID channel, really didn't know the projected volume, but it very quickly got adopted, and people were just looking for that lifeline, like Craig said, to get answers to their healthcare and COVID-related questions.
Craig, it did something for you were in a situation where unfortunately for most physician practices, revenue had dried up. You had to stop doing a lot of things. Talk a little bit about what happened with your team, and particularly your administrative staff and your physicians.
Great. So yeah, we, like everybody, kind of had a direct impact, especially once we really had patients that were kind of asked to shelter in place and stay at home. Our office remained open for, only the most essential of appointments. But at that point, essentially we had patients fall into a couple different buckets, right? You had the COVID-19 inquiries. You had COVID-19 people that wanted to know if they were potentially positive or where to get a test. At that point, we also had a lot of patients that now, once we've kind of sorted through the initial wave of the volume and information in the public got more consistent, you're having patients that still need to be seen. For prescription refills, for normal non-essential visits that couldn't come into the office. Somewhere around this time, we realized we had not started a telehealth or virtual visit arm of the business. And so we realized immediately I had to start. So we were adapting to the times, kind of threw it together as quickly as possible. But with the remote communications team, a virtual call center, if you will, we were able to basically continue to operate, but we had to really pivot. We were prepared to do it. So essentially we have 15, 16, 17 or so, depending on the time of day, call center staff that were set up to work remotely. We're set up to schedule virtual visits. We're scheduled to, we're adapting to getting onto MedChat. And as a business, this has helped us remain afloat. We really had to adapt quickly. We see upwards of 150 virtual appointments a day.
Wow.
Yeah, which has grown to that point. It took some ironing out some of the kinks, but we got that accomplished. And I really have a tremendous team that I really trust with anything at this point. So, they're working remotely, and we're pushing it as much as possible. But I think that those tools really allowed us to pivot successfully to kind of help keep us afloat, because we've had to furlough some people, unfortunately. Some people have had to take some reductions. We're doing what we can to stay even, or what we can do. But I really can credit the technology to being able to pivot and accomplish all this from thousands of miles away, 10 miles away, but not in the office.
The results were stunning. As staff shrank to a skeleton crew and appointments went almost entirely virtual, they handled a 300% increase in patient inquiries from their website. The triage bot drew visitors from search engines, with 68% of the chatbot interactions coming from organic search, indications that they had a new digital marketing tool to address COVID-19 concerns and to support the practice on the other side of the crisis. Let's step through the data in a little bit more detail here and have you shed some light from as a strategist.
We weren't sure with certainty kind of what the adoption of just this live chat and texting technology was. So really kind of overnight, we had this scaled feedback with that. I think that's really like a foundation understanding, is that we needed to shorten the life cycle of really feedback and just be flexible and iterative through all this. And that's something that just in purely volume, you can see is represented here. This shows just a comparison of about a 5-week period. And we used March 10th kind of as a trigger point, really, when we started to see kind of the initial dramatic increase in terms of the COVID-related topics. So that's really the day that we implemented a topic within MedChat. So it gives you a comparison what Craig's team had to handle, that not only did the calls initiated from the website increase from the previous period, there was then also 1,600 plus chats on top of that. So it just shows the dramatic increase in kind of patient outreach and communication.
Thinking specifically about the website as your digital front door, what would have happened in the absence of having the chat and live chat capabilities?
Well, I think that because our resources were somewhat limited to what they should be at 100%, the chatbot and the ability to triage and kind of sort through some of these details was, about as important as it could get to be able to keep up. We have a staff that works very hard and works long hours at times when needed, but the chat was really able to kind of give some semblance of grounding and anchor, to kind of be a digital net, so to speak, to get all sorts of inquiries. These could have been COVID-related, prescription, canceling appointments, wanting a new appointment in the future, questions about, any sort of thing that they would have asked the doctor in person, but they couldn't. So this really allowed us to kind of keep up with everything. And I really think that the best part about it was that we expanded our hours. People traditionally go into an office 9 to 5, 8 to 4, 9 to 6, whatever the hours are. But with the chat, people are always online, especially when they're staying at home for so long. So we essentially expanded our work hours to go till midnight, and we're able to staff accordingly. And then whatever happened between midnight and 8:30 in the morning, we were able to have an organized list there. And because our MedChat is HIPAA compliant, we were able to kind of jumpstart some of those communications first thing in the morning, really effectively and efficiently, by just pinging them via text, and then they jump right back into the chat, and they can go ahead and discuss their healthcare. Whether that be something about results or something about a test or an appointment, they can kind of pick up right where they left off, which is a really useful tool.
And Brian, we saw some unexpected statistics in terms of adoption and in terms of some of the other variables that you're used to working with as a digital strategist. Can you talk a little bit about some of the other things that we observed?
Yeah, certainly. I think these two slides really represent that. And I think traditionally people know that female are kind of the healthcare consumers and often healthcare decision makers within families. But we even saw kind of a higher skew within the last 6 weeks of women that were engaging on the chat. And then even to a surprise, really, that the technology was agnostic in terms of age. We saw an adoption really across the board, where there certainly was a higher percentage within the 25 to 34 range, but it really did spread across the board, which really represented just the demographic and age of Craig's team's patient base.
Brian, we saw a decent amount of engagement after hours. What does that tell you about the implications of what's going on when the office closes?
Yeah, I think it gave us quite a few interesting talking points that people were still working. Number one, you had a lot of people that were at home with their families and still needed to work. So their traditional 9 to 5 hours were busy, even though they were shelter in place. So we saw a pretty large increase of messages that came kind of tailing towards the end of the day, and even traditionally higher after hours than we've seen and kind of in the past experiences. And I think that's something that speaks to Craig's team and kind of their resilience to be flexible and just kind of iterate really quickly. His example of the overseas staff, we really deployed something that I would traditionally consider of a process that could take weeks, if not months, to implement, and almost do it through a weekend, where we were training NPs and PAs that were in different time zones that then were fielding these inquiries that could be handled via the HIPAA compliant chat. And people were just so thankful that they were able to get access really almost on a 24/7 basis.
And Craig, you as I alluded to a moment ago, you brought together, between your work and Brian, you actually brought together multiple partners. Maybe talk about those partners and how they all fit together.
Sure. So, we noticed pretty quickly that people fall into different buckets. So you had the COVID-19 patients that either wanted to get evaluated, but really get a test. So we've always worked with the platform LabFinder. LabFinder, in normal circumstances, books lab and imaging exams, and then the patients get their results. Our patients have always loved it. Very quickly, we realized that LabFinder was able to help facilitate getting tests. This changed a couple times based on how different guidelines were changing. Eventually, it was some NYU centers, and then it was some other locations. And we currently now just started doing the antibody test through them. But LabFinder was really able to play an integral role in terms of our patients were reaching out to us as their physician, and then they wanted to know they eventually get a test after maybe being evaluated or having a discussion or a virtual appointment. At that point, they were able to go on there and schedule a test. So in terms of being able to get them sorted, couldn't have played a bigger part. And I mean, all day today, I already can tell that people are using that to find tests. So then you have the big bucket of patients. I mean, with almost 70,000 patients, people need prescriptions, and they're supposed to stay home. So Medical Office of Manhattan and Manhattan Cardiology's preferred pharmacy partner is Capsule. Capsule has a great team. We've worked intimately with them, and this was a great time to use Capsule. And for people that don't know, it will deliver prescriptions to your home. So now we had patients that couldn't come into the office, so we built out telehealth, and you would see your physician virtually. Once you saw the physician virtually, you could choose to have Capsule send your medication to your home. So you literally didn't have to leave home. Going to the CVS, going to any miscellaneous pharmacy just presents a challenge to go out into the public when they probably shouldn't. So that really helped us kind of go from A to B to C and take care of our patients that needed that. And then we have Tidal Health, which is our been our partner for years in terms of our website flow and whatever Brian and his other partner Brian can help us with across the board. And without them and relying on their help and guidance, as this was a changing situation daily, we would have been in a tough place.
And Brian, can you talk a little bit more about your practice? You're a very specialized practice. I know you have clients that are loyal to you to the end and incredibly collaborative. Talk a little bit about kind of what your practice focuses on and about some of the other experiences that you saw as the coronavirus hit in New York City.
Yeah, certainly. In the kind of the simple sense, we really handle any digital touch point is what we call with a potential patient online. So we focus only in healthcare, and kind of our end services can be anything and ranging in terms of kind of traditional digital marketing, we'll call. But at the end of the day, we really specialize in understanding the patient's journey. And that starts really from the acquisition and their initial touch point with the practice digitally, but then working with the practice and understanding the entire experience that that patient has from kind of coming into the front door, going through their treatment or down to billing, and really every experience past that. And I think really where our relationship and our value got highlighted was kind of shortening that life cycle and feedback within the last 6 to 8 weeks, that we really needed to understand what patients were communicating, then get that back and disseminated to the patients at large. And that came through the live chat, that came through phone calls, texts, emails. And I think Craig breezes it over, but it's something that he and his team were really able to implement at scale very quickly. I can't even count the amount of kind of iterations of the process just from the live chat down to where we are today from 6 to 8 weeks ago. It's not anecdotal when you have a patient reaching out saying, I'm afraid to go out into public, or I'm not even near my primary pharmacy. I need to get that prescription. And it was great that we had a partnership in place with Capsule, but then we had to scale that. And that became the outbound communications that we were able to help to support.
So we're in a new normal. And as I think about where physician practices sit today, I think about us being having gone through 3 phases. And when I say I think about this, actually, this is Craig's way of thinking about it that I have politely and shrewdly borrowed. But there was sort of the initial panic moment as this was coming upon us. Should I fly on a business trip? I just don't know what to do. That was a flood of change. That transitioned into the new normal right now, which is how to stay in business, how to keep the doors open, how to continue to serve patients. The approach that you guys have taken is, in my mind, the most impressive and adaptive that I've seen amongst the physician practices that I work with. Let's fast forward. What do you guys think the world looks like in November, December? Let's imagine that we do start to reopen. What's the new normal in terms of physician practice? Craig, maybe I'll start with you.
So, this is evolving by the day, but there's going to be many different elements to the new normal. But in terms of our practice, we went from having 0 telehealth arm to having 150 patients a day connecting to providers as we speak virtually. It's kind of a double-edged sword. What happens there? You've inherently built in a comfort and a behavior with patients that maybe had never used certain platforms or video connections with patients. We always have really appreciated and seen a lot of value in face-to-face communication. That's why we never explored the telehealth arm. We have a great team of doctors. I've been with the practice a long time. Are patients going to potentially not want to come back into the office? Are we going to continue to offer telehealth? These raise a lot of questions, but we've built in that behavior to an awful big group of patients. At the same time, that allows them to potentially be flexible and seek out other care if they're not happy with their care here. So that's going to hold us accountable to, the same level of care we strive to always provide. But we've now made it very easy for them to realize, I can just see a doctor from anywhere. So I'm not sure we have, a true idea of what's going to happen here, but that behavior that's been adapted by patients is going to be something that I think the healthcare community at large is going to, have to adapt to, because it was always something that was growing. It was always something that we were watching. But now I think there's no going back there. So in terms of the new normal and telehealth, we'll see. But you have patients very comfortable with it now.
I think having tracked telehealth adoption for a number of years, prior to the crisis, we were somewhere around 9% of the U.S. population had generally become comfortable with telehealth, and somewhere around 20% of physician and providers, advanced practice providers, and so forth. The two big gating factors, of course, were the cultural adoption, which was traveling on a curve, but payment and a physician assistant, a provider that's delivering care over telehealth deserves to be properly compensated for that work. And I think one of the biggest gating factors is that between CMS and health plans, large employers, generally there was a reticence to pay for telehealth, because there was an anxiety that the more it was paid for, the more you could do via telehealth, that would open up the floodgates of utilization. Craig, what do you think? Do you think, we've lifted, the federal government and most health plans have lifted the barriers on reimbursement for telehealth? Do you think we go back to where we were after this, or do you think the cat's out of the bag?
It's going to be interesting to see, because, as you mentioned, we've had the government relaxed a lot of guidelines with insurance companies and reimbursement and what constitutes secure and private communications via those means. Different telehealth platforms are HIPAA compliant. Some other ones that are technically not have been relaxed, but the practice is supposed to do everything they can to make that effort. I think it's yet to be determined, but I think maybe the cat's out of the bag. And when it's all this data, mountains of data is analyzed in terms of how many telehealth appointments there were, and what was the basis of those telehealth appointments? Were they for, I have a pain in my arm, can that be done to a prescription, to review of lab results? I'm tending to go more on the side that it's probably going to remain somewhat relaxed to some extent, and it's not going to ever go back to what it 100% was, but probably somewhere in between. That's my own personal opinion, not the business opinion. But I think once you get people used to something, it's going to be awful hard to just turn that off.
I think you're right. And Brian, talk to us about your perspective on the new normal. You are one of the leading experts on how a physician practice optimizes its operations and optimizes new patient acquisition. What's going to happen now in terms of matching the right patient to the right provider?
Yeah, I think we have a unique lens because we really almost represent all specialties kind of head to toe. So it's something that overnight we saw an interest and adoption really to trying to implement telehealth really across the board with our clients. There's a lot more of a straight line in application with, say, groups like Craig's and primary care. But there was really just an inherent interest on the business side from the physicians themselves across the board. The adoption percentage is kind of skewed in a range, but it's been adopted really on every level, down to we have head and neck reconstruction surgical specialists all the way backwards to primary care. And Craig's group is that, like he said, telehealth is now introduced and adopted, and people feel comfortable with. As you kind of go down, we'll call that kind of episode of care in terms of primary care to surgery. It certainly can replace certain things more so than others. But we're seeing down to our surgical specialists that patients are comfortable having those first few touch points in communications virtually. And from really a marketing lens, it really becomes interesting because we can now really inbound patients a lot easier and offer those really as a much more soft sell to get introduced as becoming a patient of the practice. And that's really driven by public sentiment, especially here in New York, Manhattan. There's going to be months, if not years, of just kind of an uneasiness to get back to that normal. And we're seeing it as patients and practices try to operate that are less elective. We're even working with healthcare law firms here to understand and put in procedures around creating more time between those appointments, creating less interaction with those patients as they come in. And no one has the black and white answer around that. And it's really driven by public and patient sentiment, which we don't know if we'll ever get back to what it was.
Yeah, it's a fascinating time. So
I want to reference MedChat, which has been a tremendous partner to us. And what I think we learned is that we were using it already. As I mentioned before, we started to optimize it for COVID-19 and really handling that initial spike of volume. At this point, with the pushing of capsule to have people remain home, we've now started to build out different bots that are for live and for after hours that are really going to be able to help gather all sorts of additional information that are going to help our internal staff and maybe some remote staff. So I do think that lends itself to the idea that the new normal, besides payers and insurance and telehealth, is that physician offices were forced to figure it out on the fly. The ones that hadn't already adapted a system, we had a good system in place, but the ones that hadn't adapted a system probably have some semblance of communications remotely that they didn't have before. So the new normal will, and this will be a benefit, will start to push on, healthcare always has technology that's somewhat behind. I don't think that's a secret in some ways. And in terms of communications, this is going to be, one way or another, help push things along at a much more rapid rate. Practices are going to adopt after hours, are going to develop bots, and much like you went to a Verizon or your credit card company and you're interacting with an airline, you're interacting with a bot that's getting you information before you're eventually, hopefully, passed off to a live person. It lends itself in this situation for medical practices that they can get a whole bunch of information, with smart AI bots, and eventually that'll get passed off to someone. But I really think that's going to make the workflow tremendously more efficient, depending on your ability to adopt it into your flow. So that's just one last thing I wanted to add in, is that the good part about what's going to happen here, besides telehealth, is that the new normal will have certain entities in healthcare pushing the boundaries of what they can and cannot do. And maybe before they knew it was there to some extent, they weren't really optimizing it completely. Now they've been forced to try to figure it out on the fly, which will only have good impact.
Great points there, Brian. What are your closing thoughts?
Yeah, I think I can piggyback even on one of the points that Craig made, that I think healthcare is traditionally seen as an industry kind of slower to adopt and maybe a little more inflexible, and almost overnight the industry at large was kind of forced to meet consumer demand because of all the regulations that came down. So being able to virtualize, being able to have telehealth, and I think that's just going to bring more exposure really to a term that actually a client of ours introduced us to a couple of years ago, called the retailization of healthcare, that consumers have this empowerment of choice, and all the things outside of just the delivery of care now are being highlighted a lot further. And that could be the adoption or the offering of certain technologies and platforms and experience. And it's all the things that Craig and his team have adopted over the last few weeks. I think it's just only going to get further highlighted more as patients really demand different outlets and experiences with their healthcare providers. I think
it's well said, and certainly an impressive undertaking, an impressive bit of work that both of you achieved. So congratulations on your success. I know at the end of the day, your efforts were all about serving patients in a crisis, and there are long-term business implications, but thank you for your service, and thank you for what you accomplished for those patients in New York City. And thank you for joining the business of healthcare today.
Thank you.
Thanks, Matt. Appreciate it.
Visit BOHseries.com for more recorded interviews, our upcoming live cast schedule, and to learn more about our new virtual roundtables, where you can meet our interview guests and learn more about their work. You can also listen to other BOH interviews on Apple, Google, Stitcher, and other podcast platforms by searching for Business of Healthcare in our red logo.